Good evening, sir.
I think all our panelists are here, AP sir, so there is no issue.
Yes, we'll just give another 5 minutes for members are still logging in.
There are still a lot of people logging in, of course. Wait.
Vikram, waiting innu idara. Do you see any more people in the waiting?
No, I don't see anybody in waiting. Nani kanalla iga because I'm not the host. Some can see.
Okay.
Sir, am I audible properly?
Yes, sir. You are very much.
Yes, doctor. You are audible.
Yeah. Thank you, sir.
Good evening, Dr. Deepanjali.
Deepanjali from USA.
US, yes. Thank you. I think Nimge, it's an early morning.
Early morning. We really appreciate your commitment waking
Hey
up
guys.
for this.
It's 7 in the morning, all Nimge.
Sorry. 8:00.
Oh, okay. 8:00 is okay.
Midwest 8:00.
Midwest, okay.
A lot of them are watching on Facebook also.
Yes, Facebook no. We kept it as an option because ಇಲ್ಲಿ Zoom ಅಲ್ಲಿ in case we have more people logging in, so we thought Facebook also will help anta. So panelists ಗೆ ಒಂದೇನು ಅಂತಂದ್ರೆ we will also be having some enquiries on or some concerns being addressed on Facebook. So adannu illige we will take it.
Is somebody seeing that, sir? Tave ನೋಡ್ತಾ ಇದ್ದೀರಿ?
Check ಮಾಡ್ತೀನಿ sir. ನಮಸ್ಕಾರ.
ನಾನು ಜಗದೀಶ್ ಪಟೇಲ್ ಅಂತ. ನಾನು ಸಿದ್ಧಾರ್ಥ ಲೇಔಟ್ ಮೈಸೂರಿನ ನಿವಾಸಿ. ನಾನು ಎಲೆಕ್ಟ್ರಿಕಲ್ ಕಾಂಟ್ರಾಕ್ಟರ್.
ವೆರಿ ಗುಡ್ ಸರ್, ವೆಲ್ಕಮ್.
ನಿಮ್ಗಳ ಮಾತು ಕೇಳಕ್ಕೆ ಬಹಳ ಆಕಾಂಕ್ಷೆ ಆಗಿದೆ ಸರ್.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಸರ್.
ವೆರಿ ಆಕ್ಟಿವ್ ಪರ್ಸನ್ ಇನ್ ಮೈಸೂರು ಸರ್.
ವೆರಿ ಗುಡ್.
ವೆರಿ ಆಕ್ಟಿವ್ ಪರ್ಸನ್ ಇನ್ ಮೈಸೂರು ಸರ್.
ನಮಸ್ಕಾರ ಅಣ್ಣ. ಅವ್ರ ಒಂದು ತುಣುಕು ನಾನಿಲ್ಲ, ಸುಮ್ಮನೆ ಹೇಳ್ತಾರೆ. ಅವ್ರದ್ದು ಒಂದು ತುಣುಕು ನಾನಿಲ್ಲ.
ನಿಮ್ಮದೇ ಆದಂತಹ ಮೈಸೂರಿನ ಡಾಕ್ಟರ್ ಧರ್ಮ ಪ್ರಸಾದ್ ಅವರು ಇವತ್ತು ನಮ್ಮ ಎಸ್ಟೀಮ್ ಪ್ಯಾನಲಿಸ್ಟ್.
ಎಸ್ ಸರ್, ನನ್ನ ಕ್ಲಾಸ್ಮೇಟ್ ಅವರು.
ಓ ವೆರಿ ಗುಡ್. Kindly bear with us for a few more minutes. ಇನ್ನು ಕೆಲವರು ಲಾಗಿನ್ ಆಗ್ತಾ ಇದ್ದಾರೆ, ಸೊ ಅವರಿಗೆ ಸ್ವಲ್ಪ ಅವಕಾಶ ಕೊಡೋಣ.
Lot of logins are taking.
Yes.
Hey, there's a person login. Just wait. Doctor Bandro.
ಅದಿತ್ತಲ್ಲ ಹೋಲ್ಡರ್ ಏನಾಗ್ತದ?
ಅವಿನಾಶ್ ಪಾಳ್ಯಗಾರರಿಗೆ ನಮಸ್ಕಾರ. ಗುಡ್ ಈವ್ನಿಂಗ್. ಸತೀಶ್ ಬ್ಯಾಂಗ್ಳೂರ್ ಅಂತ. ಮಚ್ ಬಿಫೋರ್ ಯು ಸ್ಟಾರ್ಟ್, ಲೈಕ್ ಐ ರಿಯಲಿ ವಾಂಟ್ ಟು ಥ್ಯಾಂಕ್ ಆಲ್ ಯು ಪೀಪಲ್ ಬಿಕಾಸ್ ಈ ಮೊಮೆಂಟ್ ಅಲ್ಲಿ ಈ ಪರ್ಟಿಕ್ಯುಲರ್ ಟಾಪಿಕ್ ಅಂಡ್ ಒನ್ ಐ ಥಿಂಕ್ ಸಿನ್ಸಿಯರ್ ಥ್ಯಾಂಕ್ಸ್ ಟು ದ ಡಾಕ್ಟರ್ಸ್. ಈ ಸಬ್ಜೆಕ್ಟ್ ಅಂಡ್ ಬ್ರೀಫ್ ಆನ್ ದಿಸ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಸಬ್ಜೆಕ್ಟ್ for everybody, including each one of us, is extremely important for the lives of ours as well as our loved ones. So thank you very much anta heltini. Thank you very much.
ಶ್ರೀಮತಿ ಸುಜಾತಾ ಅವರು ಇದ್ದಾರೆ, ಸ್ನೇಹ ಟ್ರಸ್ಟ್ ನ ಸೆಕ್ರೆಟರಿ. ನಿಮಗೂ ವೆಲ್ಕಮ್ ಮೇಡಮ್. ಡಾಕ್ಟರ್ ರಾಜಶೇಖರ್ ಜಾಕರ್ ಲಾಗಿನ್ ಆದ್ರ?
ಬಂದ್ರು. ಸ್ವಲ್ಪ ಕ್ಯಾಮೆರಾ.
ಗುಡ್ ಈವ್ನಿಂಗ್ ಡಾಕ್ಟರ್.
Good evening.
Hi, good evening to all of you. I'm Sujata here.
Good evening.
Thank you very much. Good evening.
Namaste.
Namaste, ma'am. ಐ ಥಿಂಕ್ ನಮಗೆ ಈ ಸತಿ ತುಂಬಾ ದೊಡ್ಡ ಸಹಾಯ ಸ್ನೇಹ ಟ್ರಸ್ಟ್ ಕಡೆಯಿಂದ ಆಗಿದೆ.
ಹಾಗೇನಿಲ್ಲ, ಇದು ಒಳ್ಳೆ ಸಬ್ಜೆಕ್ಟ್ ಕೊಟ್ಟಿದ್ದೀರಾ, ಎಲ್ಲರೂ ಕೇಳಕ್ ಇಷ್ಟಪಡ್ತಾರೆ. ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ ಸಬ್ಜೆಕ್ಟ್, ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಆಲ್ಸೋ. ವಿ ಶುಡ್ ನೋ ಮೋರ್ ಅಬೌಟ್ ಇಟ್.
ಕರೆಕ್ಟ್ ಅಮ್ಮ. ನಮಗೆ ವಿ ಡ್ರಾ ಲಾಟ್ ಆಫ್ ಇನ್ಸ್ಪಿರೇಷನ್ ಫ್ರಮ್ ಯುವರ್ ಆರ್ಗನೈಸೇಷನ್. ತಾವು ಸತತವಾಗಿ 50 ವರ್ಷದಿಂದ ಒಂದೊಳ್ಳೆ ಸಂಘನ ಕಟ್ಟಿದೀರಾ. ಸೊ ನಾವು ನಿಮ್ಮ ಇದರಿಂದ ಇನ್ಸ್ಪಿರೇಷನ್ ತಗೊಂಡು ನಾವ್ ಇನ್ನು ಈಗ 9ನೇ ವರ್ಷಕ್ಕೆ ಕಾಲಿಡ್ತಾ ಇದೀವಿ. ಸೊ ನಾವು ಒಂದಲ್ಲ ಒಂದಿನ ನಿಮ್ ತರ 50 ವರ್ಷ
next year decade. Good.
Yes.
Start in 1 minute.
Thank you very much ma.
7:05 ಆಯ್ತು. ಶುರು ಮಾಡೋಣ.
ಎನಿ ಮೋರ್ ಕ್ಯೂ ನಲ್ಲಿ ಇದಾರಾ? ವಿಕ್ರಮ್
ಬಹಳ ಜನ ಕ್ಯೂ ಅಲ್ಲಿ ಇದಾರೆ, ಬಟ್ ಅವರೆಲ್ಲ ಜಾಯಿನ್ ಆಗೋದು ಇನ್ನು ಸ್ವಲ್ಪ ಟೈಮ್ ಆಗ್ಬೋದು ಅನ್ಸುತ್ತೆ.
ನಾನು
ಅಲೋ ಮಾಡ್ತಿದ್ಯಾ?
ಆಲ್ರೆಡಿ 70 ಜನ ಆಗಿದ್ದಾರೆ ಸರ್.
Avinash, I think we should start with because everybody is waiting. I'm sure the doctors.
Yeah, just give it 2 minutes. ಈಗ ಕ್ಯೂ ನಲ್ಲಿ ಯಾರಿದ್ದಾರೆ, we'll just ask Vikram to allow them and we'll start immediately.
You can start, sir.
ಮಾಡ್ಬಿಡಿ.
Everybody is done in the queue?
Yes, sir.
Okay. Yes. Over to you, Netra.
ಇಲ್ಲ, ಫಸ್ಟ್
I think we have Sudishna to start the event with the Vachana.
One second. Yes, Dr. Chinmay.
Can you mute everybody except the panelist, Netra ಅವ್ರನ್ನ ಮತ್ತೆ ಅವಿನಾಶ್ ಪಳೆಗಾರ್ ಅಮ್ಮತ್ ನಂದು ಅಷ್ಟೇ. Please mute everybody.
Definitely.
This is not going to.
Yes, Netra, please.
Avinash, I think we have Sudishna starting with the Vachana as a prayer. Aruna, are you there?
I have joined.
Good.
Thank you, Sudishna. You're on mute. Sudishna.
Yeah, I'll start. Sharanu Sharanati. ನನ್ನ ಹೆಸರು ಸುದೀಶ್ನಾ ಸತೀಶ್. ನಾನು ಈ ದಿನ ಪ್ರಾರ್ಥನೆ ಯಾನವಿ ಮಾಡುತ್ತಿದ್ದೀನಿ. ಓಕೆ, ಸೊ I'll start now. ತಂದೆ ನೀನು, ತಾಯಿ ನೀನು, ಬಂಧು ನೀನು, ಬಳಗ ನೀನು. ತಂದೆ ನೀನು, ತಾಯಿ ನೀನು, ಬಂಧು ನೀನು, ಬಳಗ ನೀನು. ನೀನಲ್ಲದೆ ಮತ್ತಾರು ಇಲ್ಲವಯ್ಯ, ನೀನಲ್ಲದೆ ಮತ್ತಾರು ಇಲ್ಲವಯ್ಯ. ಕುಡಲ ಸಂಗಮ ದೇವ, ಕುಡಲ ಸಂಗಮ ದೇವ, ಕುಡಲ ಸಂಗಮ ದೇವ, ಕುಡಲ ಸಂಗಮ ದೇವ. ಹಲಲದ್ದು ನೀರಲದ್ದು, ಹಲಲದ್ದು ನೀರಲದ್ದು, ಹಲಲದ್ದು ನೀರಲದ್ದು, ಹಲಲದ್ದು ನೀರಲದ್ದು.
Thank you so much, Sudishna. That was wonderful. Ellarigu namaskara. On behalf of the ILYF Trust and AOP, I'm very pleased to welcome Shri Arvind Jati, President Basava Samiti, Srimati Uma Devi Chandrasekhar, who is the President of Sneha Trust, Srimati Sujata Rajanna, also from the Sneha Trust, all the members of Basava Samiti, the Sneha, and our very own fellow ILYFers. Even after a year of the COVID pandemic, I'm sure all of us are still have many unanswered questions, and a lot of confusion still prevails amongst us. And with the new reports of the next wave in the horizon, which might affect the younger population and more so with the kids, it is imperative we be better prepared to face these challenges. So today we have a distinguished panel of doctors who have taken time out of their busy schedules to help address all our concerns, at least most of them. I warmly welcome Dr. Nishant Hiremat, Emergency Medicine and Trauma, whom we can't thank enough for all his untiring services to the community. Thank you, Nishant. Dr. Rajshekhar Jaka, who's a cancer specialist. Dr. M. Dharma Prasad, CEO and Chief Scientist of Prosetta Bioconformatics Private Limited. Dr. Abhishek S. Aradhya, who is a consultant neonatologist, pediatrician, Dr. Shivling Swami Salimat, clinical and interventional pulmonology, Dr. Prashant Madhapura, neonatologist and pediatrician, and last but not the least, Dr. Chinmay Chikteri. Let me give a brief intro of the expert. He will give us a brief introduction of the expert panel over here and will also moderate today's program. I would like to give you a glimpse of the professional background of Dr. Chinmay. He's a director and CEO of Health Minds, where he's responsible for driving the overall strategy of the company. Prior to founding Health Minds, he was a consultant with various organizations in areas of medical publishing, healthcare, IT, and research advisory. He has also worked with the Kempegowda Institute of Medical Sciences as its scientific project coordinator for its HIV/AIDS program. He's a Bachelor of Dentistry from India and holds a Master's of Infectious Diseases from the University of Western Australia, Perth. He also has a distinction of being a student of and working with Professor Barry Marshall, the Nobel Prize winner for Medicine and Physiology for the year 2005. In 2014, he's a 2014 fellow in the Startup Leadership Program in Bangalore. So without any further delay, let's get started with today's event. We would be delighted to have your questions, and Dr. Chinmay will take them up during the program with the concerned experts. Thank you, and I once again welcome all of you. I think Chinmay, you can take it from here.
Thank you, Netraka. Thank you very much. Thanks everybody for joining in. I just have one hygiene factor before we get started. Vikram, panelists na unmute madi, please. Athwa if panelists can unmute themselves, that will be great so that we can get started. Fantastic.
Am I audible?
Yes, sir. You're audible. Thank you.
Thank you.
Welcome everybody. As the moderator of today's event, I will start by introducing our distinguished panel. First, our very own ILYF, Dr. Nishant Hiramat, Senior Consultant and Chief of the Department of Emergency Medicine and Trauma. He's also the Nodal Officer for the COVID-19 operations at Bhagwan Mahavir Jain Hospital. And he's also the South India Medical Representative for the FMSCI. His undergraduation was at the Rajiv Gandhi University and then MD in Accident and Medicine, Emergency Medicine at the Sri Ramachandra University in Chennai. I'm not going to go into a detailed list of all his achievements, but he's a widely published professional. He's been faculty for International Medical School for Malaysia, and also is an American Heart Association certified cardiac life support instructor. Just proud to say that he has treated in excess of over 1,000 COVID cases in home quarantine and almost in excess of 5,000 COVID cases in his inpatient departments at the Bhagwan Mahavir Jain Hospital. And I think he's been also the go-to person for all of our ILYFers who got infected or who had queries about COVID-19. Dr. Nishant, welcome to our program.
Oh, Dr. Sorry for some technical change. I am sorry, within 2 minutes starting. The technical team is resolving the issue.
Okay. So Dr. Nishant Hiramat, welcome to our program. Where are you? If you can just acknowledge.
Thank you. Thank you so much.
Thank you. Thank you. Great.
Sorry.
Our second panelist for the day is Dr. Shivling Swami Salimat. He is the Chief Consultant and at the Department of Clinical and Interventional Pulmonology at Trustwell Hospitals in JC Road. He's a graduate of the JJ Medical College in Davangere, and he's also an MD at the JSS University, JSS Medical College in Mysore. He was assistant professor before he actually started his consulting gigs. He's also received the prestigious NCCP Professor S.N. Gaur Young Scientist Award in Pulmonology at a national conference in 2019. He's presently actively involved and leading the team in managing over 4,000 COVID cases at Trustwell Hospitals, Bangalore. He's also a widely published author in a lot of medical journals, and he's also contributed to medical books. So, Dr. Shivling Swami, thank you very much for joining us and welcome to the program, sir.
Thank you, sir. Thanks a lot, ILF team, to give me an opportunity to be a part of this wonderful program. And I hope that I do justice to my job.
Thank you, sir. We have two very distinguished pediatricians amongst us today. I would like to start by introducing Dr. Abhishek Aradhya, who's an MD in pediatrics and a DM in neonatology, and also holds a degree from Boston. And I think he's he completed his MBBS at the Bangalore Medical College, and then acquired his MD pediatrics degree from the very prestigious PGI Chandigarh in India, and then a DM neonatology also from the PGI Chandigarh, and he has a PGPN in pediatric nutrition in Boston. Also, very highly published author. He's published almost 13 to 15 papers, and he has contributed to almost 7 medical books on pediatrics and otherwise. Sir, thank you very much for joining in today, and welcome to the program.
Thank you, sir. Thank you for giving opportunity to interact with people. Thank you, sir.
Next, we have another pediatrician on our panel this evening is Dr. Prashant Madhapur, who's a consultant pediatrician and neonatologist at the Child Specialty Clinic, and also a consultant at the Columbia Asia Hospital, Hebbal, and also I think he's a faculty at the Akash Institute of Medical Sciences and Research Center in Devanahalli. He's a MBBS and an MD in pediatrics, and also a fellowship in perinatology and neonatology. We also see that he's published also widely on fungal infections in children, which we will talk a little bit about today. He's an extensively, and I think a very highly in demand speaker, because he has done so many speaking assignments. Perhaps I will take all evening to go through this if I went through each one of them. Also, he has served stints abroad, especially in the US, wherein from Baltimore to Washington, and even in the University of Illinois in Chicago. Dr. Prashant, it's a pleasure to have you amongst us today. Thank you very much for coming on our program.
Thank you, Doctor. Thank you, Chinmay. And thank you for providing opportunity to interact with all my dear friends, all my senior colleagues. And a lot of people are here. I think all of us will learn a lot of things in this platform. Thank you.
Thank you, sir. It's my pleasure now to invite and also introduce another ILYFer, Dr. Rajshekhar Jaka, an MBBS and a DNB in surgical oncology. He's a European board certified surgical oncologist with a robotic surgery fellowship from the Roswell Park Cancer Institute. If you're an oncologist, we all understand that Roswell Park is one of the most prestigious institutes in the world. He also holds an FRCS from Glasgow and a thoracic oncology fellowship from the MSKCC in New York. He has his MBBS from the Gulbarga University, and then did his DNB. Of course, this is the National Board of Examinations from New Delhi on his surgical oncology work. But what really caught my eye in his profile was he has a certificate from the India Book of Records from removing the highest number of tumors in August of 2019, which I think is a very proud moment for any clinician working in this space. Also, a very socially, a person with high social concern. Is also chairman of the Sankalpa Chase Cancer Foundation Research Trust in Bangalore, which does a lot of which conducts a lot of free cancer screenings and also help poor needy patients for cancer treatment. Also, like the rest of our extinguished panel here, he's a very well published author, both in international and national journals, and also a very well respected speaker in many conferences, both nationally and internationally. Dr. Rajshekhar Jaka, thank you very much, sir, and welcome to the program. Sir, can you hear us?
Thank you.
Thank you, sir.
Thank you.
Finally, again, our own ILYFer from Mysore, Dr. Dharma Prasad. He was on our panel last year with Dr. Nishant Hiremat. So Dr. Dharma is the CEO and Chief Scientist of Prosetta Bio Conformatics Private Limited, a US-based biotech and pharma company. He directs research on new drugs for infectious diseases, brain disorders, and cancer. Dr. Prasad has a master's in biochemistry and PhD in biotechnology. I mean, like everybody, like rest of the panel, Dr. Prasad has published 7 books and has more than 9 research articles in very, very high impact journals. He's also a key startup entrepreneur. He's co-founded 3 successful companies, and he has a huge interest in delivering value to society through his non-profit organization, Samvida Trust, and the Berunda Innovation and Entrepreneurship Foundation in Mysore. Dr. Dharma Prasad, welcome to the program again.
Thank you very much for having me on the panel. I'm very excited to speak to you.
Can be a little louder, sir.
Thank you for having me on the panel, and I'm very excited to speak to you. Thank you.
Thank you. Great. So I'm going to get started with a few questions, and then this is going to be, like I said, a very free-flowing panel discussion. Let's see what are the points that will come up. I want to start with Dr. Nishant. So, quickly tell us what you as a clinician you have seen as a difference between first wave and the second wave. I'm sure there are some very, very salient differences that you would have seen.
Yeah, absolutely. I think to start with, I think it's been, to tell you the truth, I think it's been devastating, as all of us know. That second wave has caused more of the worry, grief, and fear in people. I would say that we've lost more lives than the first wave, and probably because of the double mutation of the virus, it's become it's even more dangerous and serious. And we've been having patients who come with probably the younger strata of people. I think Dr. Shivling Swami will support me with this, that we've had younger strata of people who've been infected and affected as well, without probably showing much of symptoms except for certain kind of fatigue, extensive fatigue that they've had. And these guys, when they come in, and they've been absolutely normal except for the fatigue, and when we've investigated, we've seen that they've had extensive infection extending into the lungs, and it's been pretty bad. And the moment we actually investigate them, within few hours, they've been on a ventilator. So that is how bad the infection was. To tell you again, we've been doing a lot of investigations like RT-PCR, of all of us know. It's been negative for most of the patients in this second wave than the first wave. First wave, we could find out that, okay, it's negative, they stay back home and nothing much to do. But right now, we look at it as RT-PCR negative. We will term that as a COVID-like syndrome, and then we treat these patients accordingly, according to the COVID itself. So even we don't depend on the RT-PCR. Right now, we depend on the clinical symptoms and the, the laboratory and the investigative radiological investigations. So that is one of the other thing. And it doesn't give us much time. And second thing is that there is longer stay of the patients. In spite of treating these patients, I can tell you that probably they would have not had any symptoms till the 10th day or something like that, and they come back to us. This is probably because of the immune-mediated response in the body, for which they come out, and then we need to treat them with certain drugs. But again, they've had problems with not because of the infection, could be because of secondary bacterial infection that they develop when they come to the hospital, or the immune response that happens. And the longer length of stay, and probably because of extensive fibrosis of the lungs, they probably stay on the on a oxygen support for a longer time. And we've seen now patients coming back to us with a lot of blood clots, where we call it as thrombosis of the limbs or the legs or something like that. And we see that we've had thrombosis of these patients, and we had to surgically operate these patients in our hospitals. So there are few more that can come in. That is how we've had the difference between the second and the first wave.
Dr. Shivling Swami, can you add to that list, sir? I mean, you've been at the forefront of treating these cases every day. What else have you observed?
Yeah, hi. Am I audible?
Yes, sir. Please go ahead.
Yeah. So what sir said is absolutely right. We've been seeing lots of younger people getting involved in this severe COVID infection, and a lot of younger people, especially starting from 15 years, have seen people developing moderate to severe pneumonia right from 15 years of their age, 19 years of age. And especially we have lost many patients between 30 to 40 years of age, which is their a highly productive age, wherein the whole family is completely dependent on them. A father of small children, a mother of small children, like this. Many people are completely dependent on the whole family and the whole. Some people may be the main earning person of the main person to earn middle butter of the family. Those people are lost, and the whole family is on road. So definitely, it's so very much overwhelming, and it's very heart thrusting that seeing these younger people die. So many patients coming up with thrombotic features, especially pulmonary microangiopathy. Even though you don't see gross pulmonary embolism on a CT pulmonary angio, we are still having patients having very high D-dimer, even though their CRP goes down. They're having very high D-dimer, they're having pulmonary microangiopathy, they're having typical pulmonary embolism features, but not able to fix it up on CTPA. And many of the RT-PCR tests are negative. We have to rely on CT thorax and clinical features to tag them as COVID-like syndrome and treat them aggressively. Definitely, this second wave has created a big havoc. Mortality rate is pretty high, and also in the last 2 months, it's been a hell what we have seen in our hospitals. People dying, people coming with lot help. I've been seeing more than 60 to 70 OPDs every day, starting from 3 o'clock till 11 o'clock, 12 o'clock. I have done OPD. More than 120, 130 patients admitted under me. Really, it's very hard to see young people losing their lives for this COVID.
Thank you, sir. Dr. Rajshekhar Jaka, if you can throw some light on the public health aspect of this, why do you think that people in productive age groups, people younger age groups, were actually more affected than the older age groups in wave 2?
One thing ಹೇಳಬೇಕಂದ್ರೆ probably older people were little vaccinated ಒಂದಿತ್ತು and they were at home rather than young people who are in the society outside there, them getting infected because they were exposed. One thing. Second thing is probably virus has become more virulent, so more younger people are getting affected because first wave only older people got affected and with comorbidities. ಅವ್ರಿಗೆ ಟಾರ್ಗೆಟ್ ಮಾಡಿ ಅವ್ರಿಗೆ ವ್ಯಾಕ್ಸಿನೇಟ್ ಮಾಡಬೇಕಂತ ಪ್ರಯತ್ನ ಮಾಡಿರೋದು ಬಟ್ ಇರೋದು ಇವಾಗ. So probably that is the reason, more aggressive disease, more infectious disease, and because young people are going out because probably that is the reason.
So I'll come back to a whole section on vaccination. I will not touch upon that now, but perhaps you can think about what was the vaccination strategy. Was it even the right strategy going forward? But I'll jump over to Dr. Dharma Prasad here. Sir, can you explain to us what was the mutations and what really caused the increase in virulence in this second wave? And also from a public health perspective, is second wave always higher in these pandemics, or is it just that in COVID-19 it is an aberration?
Okay, let's understand a little bit, take a step back. This is an RNA virus. So RNA is one of the nucleotide which is inside the cell, which is kind of a messenger, where from DNA, which is the storage of our hereditary system, it becomes RNA, it moves into the cytosol, and it translates into protein, which actually does the function. Now, RNA has to be converted back to DNA once it enter the cell, and then it is translated into viral proteins, which actually do the function inside the cell, which actually does the damage, right? So imagine an army of just 10, 15 proteins, which is contained in the virus, takes over 20,000 proteins in a cell, and then it just controls the entire cell. That is how strong these viruses are. They recruit the proteins from the cell and they take over and they do their function. Now, during the conversion of this RNA to DNA inside the cell, there is a lot of chance of mutation. Now, this is how nature has designed this virus so that it changes very fast. Because of this, it evolves very fast. Whereas for humans, it needs about through 20, 30 years to evolve to change one particular gene. Assuming 3-4 years is one generation. In viruses, it is like happens in minutes. So there are a few mutations which these viruses acquire after it has started in the first wave out of China, which has created it to be more infectious, more strong. It creates a better affinity to the cell, so it can get in. It creates better ammunition for the virus so that it can replicate better. It can transfer to different tissues better. So it has acquired many mutations over a period of time. What we talk about the double mutation and the triple mutation is basically the mutations of concern. Actually, there are 400, 500 mutations which it has acquired in the last 1 year. So on an average, it acquires a mutation, let us say every 3 to 4 days. One mutation every 3 to 4 days is the assumption. It could be even faster. But only the mutations which are of concern, which actually enhances the virulence, enhances its ability to infect, is what is we get worried about. And that has happened. It was observed first in UK, then in South Africa, then in Brazil, then in India. Now the Indian variant is called Delta variant, which is a double mutation, and this has become very highly infectious. Now we are seeing this extensively multiplying in South Africa and UK. Now they are going to get the second or the even third wave with the Indian variations, and that makes it more virulent, more difficult to control and treat, because we don't understand it well enough. It is a new virus for us. It takes some time for us to fight it over.
But what parallels can you draw to the Spanish influenza and the COVID influenza pandemic that we are seeing today? Is always the second wave the biggest wave, or is this a sort of a...
Yeah. Sorry, I forgot your second part of the question. Yes, second wave is always bigger. The first wave is generally one which touches and goes kind of thing, if you can imagine in a common man's world. Right. Second wave is generally bigger, and third and fourth is going to go down, and then eventually it will have a stability in the population, or eventually have wrong mutations accumulated inside the virus and it dies. Second is generally the peak in most of the infectious diseases. And we see a huge amount of infections for various reasons, for psychological reasons, for evolutionary reason of the virus, for immune reasons of human system and all. And COVID, the virus as such doesn't do much. It is the response of the human body which is creating more problem. Because of the cytokine surge, that as soon as the virus comes in, the body sees it as a foreign and it tries to attack. Because sometimes, depending on the genetic makeup of a person, it overreacts. That means it reacts more than what it is supposed to react, and it goes and just it's like a bomb which blasts across. So it kills the terrorist and also the other innocent people. When it happens, that's how the body responds. Then it over responds beyond its capacity. It just damages. So second wave is always the peak, and hopefully the third and the fourth wave are going to be lesser.
I'll skip over to Dr. Abhishek Arathya here, sir. I mean, there's a lot of myth and misinformation that is getting passed on WhatsApp and other social media about how this affects children. So can you just give us, in a minute or so, what sort of symptoms do children see? Basically, children individuals age less than age 15. If you can throw some light, and also if Dr. Prashant can add to that list and let our viewers know.
See, actually, in children, fortunately, unlike adults, the severity is not much. Most of children will present to us either as just fever or fever with cough or cold. And few of the children are also presenting only with vomiting and loose stools without any fever. So that's a challenge. Most of the parents wouldn't agree for testing, but plain fever or loose stools, that's a challenge to convince the parents for testing. So the common symptoms in children would be, I would say, fever or fever with respiratory symptoms or with GI symptoms as well. But for a newborn, what we are seeing for the last couple of months, newborns are also presenting only with poor feeding, that they are tired, not accepting feeds. So with just low-grade fever, even the newborns are presenting in the second wave. But fortunately, let's not get scared with this third wave, or is the children getting affected or not. Fortunately, what we have seen is that most children respond very well to supportive measures. They do not need big medications like remdesivir or steroids. Very few children require higher medications, and most of them without much bad outcomes.
Great, sir. Dr. Prashant, I want to ask a follow-up question on that. Number one is, why are children seeing a less severe disease than when compared to adults? And number two is, but children are still, they can still transmit to adults, right? I mean, they are quite infectious, right? So can you throw some light on that, sir?
We have, especially when it comes.
So can you be a little louder?
When it comes to any viral illness, okay, most of the children do not respond very strongly in the form of symptoms. Especially if you look at a simple viral illness, it's a simple virus. If you look at the COVID virus or coronavirus, it's a simple virus. So all of us in our childhood have had a simple virus, fever, cold, cough. So it's like anything like this. One good thing about the pediatric population is it is not a very mature immune system. It is still yet maturing immune system where the virus will not, the entry of virus into the body will not create a cytokine storm. So basically that storm is created when there is a good immune system, strongly based, and it is an hyperreactivity to the virus entry. So one good thing about the pediatric population, especially 10 to 12 years, is they don't create a cytokine storm as it is seen in adult population. So basically, that is one fortunate thing which, with the God's blessing, I think most of the children are having a very mild symptom. So last week, from Monday, we are having a lot of milder cases where most of the children are coming with RT-PCR negative, with fever, mild fever, once or twice loose motions, vomiting. Basically, this is one of the milder complications of COVID. That means these children would have had COVID last month or 3 to 4 weeks back with their family members, but that time they did not have any symptoms. So they just had a simple 1 or 2 episodes of mild fever and they crossed over it. And now for last week, I've seen more than 12, 13 cases coming with mild fever, loose motion, vomiting, little irritability, and joint pains and all. So that means they've entered into an acute or a mild complication of COVID. So that is where the most of the children are falling as of now. Since the third wave, it was a really sad expectancy. We should not say expectancy. It is a sad expectancy that we are waiting for a third wave which is going to affect pediatric population. When we discussed with the task force wanted to keep everybody vigilant and little aggressive on prevention of complication of pediatric COVID. See, here the main agenda of thinking about a third wave is expecting in pediatric is to prevent the death which happened on the second wave, to prevent the acute complications. So that is one important thing all of us are focusing on, because the transmission anyway is going to happen at a lower rates, because children, any adult is affected, it is going to definitely affect their children, especially the other sibling or a small baby or a school-going child, which is going to be very difficult to monitor. So what we are thinking in this aspect is, let us recognize the complications early, initiate the treatment. As Dr. Abhishek said, there are no major extraordinary drugs to treat COVID or a complication of COVID. There are only 3 or 4 medications. But what is important is recognition of the severity of complications of COVID, like multi-system inflammatory syndrome, which is because of COVID. So this is what we are coming across for the last 1 week. I'm talking about the last week. So we will have this, what do you call shortly, inflammatory syndrome coming up in next 1 week, 2 weeks, 3 weeks. Most of them are affected in the previous month, that is in the month of May and April. So complications in pediatric always comes after a month of illness. So it is not seen as acute phase. Means a parent is affected on March first week, the child might get affected in acute COVID, but usually presents in the month of April with one of the complications. Either past myocarditis, it's called viral myocarditis, or it's called acute renal failure. So all this comes on the next month. So we want to keep the public on high vigilance to note their children for complications of COVID. We have pediatric population will definitely fight out acute COVID. because their immune system is wonderful. But we have to watch the complications like multi-system inflammatory syndrome and some of the bacterial infections along with this viral infection. So this is one thing which I think I want to put it as in a public platform. Please watch for one of the or to any of the complications which is affecting children. Keep close watchful for next 3 months, 3 to 4 months. I think all of us will win this acute COVID infection without any problem. We have almost crossed the 50% of a pandemic. So it is just going to wane off. As Dr. Dharma said, it's going to come down with small episodes of the third wave, fourth wave, fifth wave. As it goes on, the wave is going to be less severe and less mass effect. So I think that is one thing. Since pediatric is a very emotional subject, I think all of us as doctors are also a little worried about the affecting the pediatric population because there are no much pediatric hospitals. So I think we have to be vigilant on that also. If you look at the beds in Bangalore, there are not more than 500 beds, pediatric beds in Bangalore per se, including the government hospital, private hospital. So we are in the verge of creating the pediatric beds. So I think we should be knowing, which is what my personal opinion.
Dr. Abhishek, I have a follow-up question to you. I mean, children are known, this is all what we have read in public domain, that they're known to be super spreaders, and that's one of the reasons why they've not opened schools and many other things. What is the real science behind this? I mean, are they really super spreaders or is it just that it's just going around in social media that way? Can you throw some light on that, sir?
So I think I would like to re-emphasize what Dr. Dharma Prasad sir said. He mentioned that COVID severity depends upon the immune response. Fortunately, the immune response in children are robust. Very few of them have such autoimmune response or immune dysregulation in children. So most of them will have very mild symptoms like cough, cold, vomiting, or loose stools. So they're not brought to attention. So once they're not brought to attention, these children will actually continue spreading to adults in the house, especially elderly people. So especially the grandparents, so for that matter. So hence in children, actually, the symptom severity is less. They're not tested for almost 7 to 10 days. They remain infective and they continue spreading in the houses. And once they go to play, they even spread to other children and those children take it back to home. Similar in a school situation as well.
Correct. So they do have the potential to be super spreaders is what you're saying because they move around quite a bit. Okay, great. I want to cross over to Dr. Shivling Swami. Sir, see, the focus of this seminar was not to talk about COVID itself because there's so much public education already on this. But I want to skip over to some of the public health aspects of COVID because I think our audiences here are very informed audiences. They want to know what went wrong or what went right in this. Now, in your personal opinion, what do you think of the preparedness of the health infrastructure in our cities and in our towns, in our state and country to deal with a situation like this? What has been your personal experience? And I also want to ask the same question to Nishant after you respond.
Of course, you are right. The preparedness of the whole society for this second wave was actually not that much, what I would say, because government would have been more proactive in providing more healthcare facilities, especially basic facilities like oxygen. And we had to really go out and ask other countries to help us with oxygen. So that was a state where what we have already seen. So between the first wave and second wave, we literally had 3 or 4 months of gap wherein when the whole scientists as well as the well-informed people were already predicting the second wave is going to come hard. So the preparedness of all the health facilities, especially in the government setting, would have been much more robust. We would have got this thing under control. Many people, what we have already noticed, that the people are losing life on the road, not just because not getting oxygen, just because not getting beds. So and because the second wave is definitely more, this virus is more virulent because of the existing and new mutations, and it's more virulent and mortality is pretty high. We've been observing that. So health facilities preparedness was much more important, especially beds and oxygen facilities. And anyways, we know that in the first wave, we were using a lot of drugs. We were trying a lot of drugs because no one knew properly how it was behaving. So now we know that what in the last 1.5 years of experience, we know what to do, what kind of medicines to be used. Remdesivir need not be given to everyone. It has to be given to only a few people who require hospitalization, who are developing pneumonias. Only hypoxic patients should require remdesivir. And what we have even seen that there are a lot of inequality in distribution of the medicines as well as beds, and some nonsense people are hoarding the medicines. People are not getting beds. The needy is not getting the bed. And someone who is absolutely fine, who wants to be at home, who is quite fine enough to be at home at a home isolation, is coming and occupying the bed. These kind of inequalities, if it were to be addressed between this particular gap between first wave and second wave, and if you are more robust in following our protocols, especially in the periphery, here I feel that we have failed to a far extent, that we could not handle this second wave pretty effectively. Of course, now that there is a fear that third wave is going to come, it's going to affect much more younger population. We really need to come out of this box, and we need to think proactively, make the health facilities available for everyone, especially the government settings has to be much more robustly made strong. Get in more beds. I'm sure there are multiple COVID care centers here. They are coming, creeping up and then again closing, because now second wave is slowly going down. But now the government hospitals need to be strengthened. Government healthcare facilities need to be more strengthened. More faculties have to move in. People have to be more proactive in getting, especially oxygen facilities, getting an oxygen plant into their hospital. Hospitals with 100 beds and more should have their own oxygen plant, so that it hardly takes 1.5 months or max 2 months to have an oxygen plant. I don't think so. For the bigger hospitals, and even for the government for that matter, is a big deal for having oxygen plant at every government hospital facility around the country. So definitely making proper bed facilities as well as oxygen plants, wherein the hospital itself can produce sufficient oxygen to provide it to its patients. So this is one important thing, and the proper distribution of medicines, especially remdesivir, steroids, anticoagulants. I have faced crisis not only for remdesivir. I've even faced crisis for steroids. Oxygen is always there. I have faced where we used to get methylprednisolone 40 mg vial easily. There was a situation during the end of April or in the first part of May, where we were not even getting 40 mg of methylprednisolone or dexamethasone readily available in the market. So I had to go for and take 1 gram of methylprednisolone, dilute it, and take 1 vial and distribute to all the patients. So this was a situation when I have seen practically on the ground what I've seen, and we have to manage things in a more protocolized way. So if we manage things in a more protocolized way, everyone has to be aware of what they're doing. If these basic things are kept in place properly, I am sure that the third wave is just easily can be managed.
Nishant, your thoughts on this, sir, because you are managing one of the biggest COVID centers in Bangalore, one of them. What has been your experience, and what do you think that we can do for not being in such a situation in wave 3?
Yeah, I think I would agree with Dr. Shivu. But what I would say is that I don't think so. We need to look at preparedness. It's not going to happen in 1 or 2 months. Right. I've been working closely with the NDMA, National Disaster Management Authority. What has happened is they've been doing it amongst the government officials. Okay. Only thing now they've understood that they have to have a public and a government partnership where both need to come together, and that is how you will bring out a better preparedness for any disaster. All of us cannot prevent a primary disaster that happens, but definitely we can counter the secondary insult that happens because of the disaster. I agree with whatever the beds and the drug. This is all the preparedness that we should have done. Even after the first wave, we just had about 4 months for a second wave to come in. It was already being told that, yes, I think to the government that you need to get ready. Not to blame the government. And I think whatever said and done, whichever government at this point of time would definitely face such kind of a crisis, because the preparedness wasn't there. Happen overnight. It cannot happen in few months. It has to happen before itself. Probably we have to prepare ourselves, get ready so that any pandemic. See, we've had SARS in 2002, 2003, right? And even somewhere around 2009, there was probably a pop-up of the coronavirus. People, I'm not talking about corona. If you look at it, ask everybody, I think who have been doctors, you can see that we had 4 or 5 lines on coronavirus.
Right.
Now you see more than 2 lakh, 3 lakh papers on coronavirus. You can actually make a book on it. So that is how devastating it has been. Whatever said and done, there has been a conspiracy or whatever is been there. Keep it as whatever we could do at this point of time by the private hospitals. I think even the government, whatever the support that they had, they've done it. I think, see, none of us can prevent deaths. We've had overwhelming patients coming into the hospital. I'm telling you, we've not had patients go out of the hospital. Whatever said and done, we've even treated them on a stretcher. We've had patients packed everywhere, even in spite of telling the government that we only have so many beds reserved for COVID. We've been extending it and giving it to most of the patients. And we've not patients out. Seeing them, I think they've been dying on road. The way he said, ambulance is waiting to get into the hospital. We've seen deaths there. We've declared deaths in the ambulance near the parking lot. Everything has happened. So this has been very, very overwhelming. I don't think so any of us could have probably mitigated it to the extent that it was required. Probably, I think it's happened. I think probably third wave, we need to understand and prepare ourselves better so that we don't lose children. And as both the panel told us, that because of their immune system, I think we do not have so much of cytokine response storm by the children. So probably they will have infection, but it will be mild. Can have a multi-system syndrome involvement of the inflammatory syndrome, what I can say, MIS in children, which can happen, and probably it can't be fatal. It can be, it is not devastating. You can see that we've already had a third wave happen in Maharashtra and Ahmednagar, about 8,000 kids that were infected, but we've not had deaths to the toll that we've had it in adults. The way we were speaking about cytokine response and the immune system, I think we've not had. I think probably, I think these two will come back to you and tell you about the immunization of the children right now, so that we cope up with the vaccination. So I think that is it. I think whatever said and done, whatever we have done, I think we've done it to the best of our abilities.
Of course. I really want to add up, sir. It's amazing. What you said is absolutely right. See, I would rather put on this forum to the public, wherein you need to get properly aware. So awareness is the most important thing. You should know regarding the disease. You should know what has to be done. You should spread good messages across. You should educate other people, educate your own family members. We need not panic. We have to act responsibly, take medical help immediately as soon as you feel that you have symptoms, as soon as you have been detected that you have COVID virus infection. You have to have a responsibility to take medical help and take treatment properly and educate other people. Need not to panic. So it is the panic which is leading the whole thing across around, definitely. Yeah.
Absolutely. I'm going to go to Dr. Rajshekar Jaka here, who's an oncologist.
Chinmay, 1 second. I just want to put across one more thing, because we were talking about beds and other things. Everybody felt, because this is what we've come across, everybody thought, because most of them are from Bangalore. What I say is, you don't have to wait for a BU number. That's a Bangalore urban number for you to get admitted to the hospital. Most of the people thought they have to wait for BU number before they get into the hospital. That is how the delay of patients getting admitted to the hospital was there. If they feel that it is just normal, they need to come and get admitted. They don't have to wait for some number by the government for them to get admitted.
Got it.
In case of COVID. So that is what I wanted to put that across.
Thank you, sir. I think that's very important. So Dr. Rajshekar, you are now, as an oncologist, what has been your experience managing, especially comorbid conditions, but in specific cancer cases during the times of COVID? Because we have seen in the newspapers and other reports that admissions and people willing to come for treatment for these kind of chronic illnesses has really dipped. What do you think that has had a collateral effect on on the health indices of the country?
No, definitely, I think lot many other patients have suffered. There is no doubt about it. Even first wave when there was a lockdown, many patients could not turn up for regular treatment. So because cancer is such a disease where time is very important. And at stage 1, 2, 3, 4, if there is no treatment for over a period of 4 months, then definitely stage will change 3 to 4 months. So that has happened even in the first lockdown, because so many people have lost their life. Even second wave because they could not come to the hospital. One more thing is fear of getting infected with COVID. So they themselves are not coming. Last week I operated 3 to 4 cases. They came with intestinal obstruction. And tumor has grown so much that now with obstruction in they came to emergency. They could have come because of the fear of COVID. So definitely, first wave even Kidwai Cancer Hospital, government hospital, because of fear of COVID, and we don't know what is going to happen to the doctors also. So everything was like functioning partially. So tumba patients who suffer agidare. Unfortunately, we should, I think we should try to balance both the things. Even though I was, means you asked about public health.
Yeah, sorry, but what is what is your message to people who have situations like this, and how can you instill some confidence for people to actually get those treatments, despite whether it's COVID or not COVID? Get the treatment.
See, most of the hospitals have facility for other patients. They have exclusively separated. So I don't think there is any problem in treating other ailments. Sometimes we have advised the local doctor over there, if they cannot come from like cities out of Bangalore, we advise the local doctors to administer chemotherapy or basic treatment until they are able to come to our hospital. So that coordination is important. Okay, doctors, patients in connectivity in the definitely we will be able to at least solve part of the problem.
Right. So what is the possibility of somebody, coming in for, like, say a surgery in a place like Colombia, Asia, and what is the probability of them actually getting infected by COVID? That's been the biggest fear. Can you bust that myth here for everyone?
See, frankly speaking, I have never seen a patient coming to the hospital and I have treated for a cancer, this one, and they went or they got complicated with COVID and shifted to ICU. Okay. It has never happened. Okay. And one more thing, there is a lot of this one, like COVID infection, we have to wait 6 months for the surgery, 6 weeks for the surgery. Many times we had to do it early, but frankly speaking, we have not seen any complications. But we have waited for 2 weeks. So I think we should not have too much of fear of COVID when there is means cancer, which is also equally or more dangerous many times. There are options, there are facilities in the hospital to separate them and treat them. It is totally. Hello.
Sir, yeah, I think you had just gone blank for a moment. So you are saying there are facilities in the hospitals to separate them.
Yeah. So don't have to worry. Don't have to be scared. There are totally separate wards, separate floors. I don't think they should worry. Okay. The risk is very minimal. That is how hospital means doctors have taken care. I don't think they should worry.
Fantastic, sir. Thank you. That will, I think, instill some confidence amongst our viewers. I'm going to jump into Dr. Prashant's window now. Dr. Prashant, you're also part of the COVID pediatric task force, if I'm not wrong. I think you're advising the government as well. Sir, can you give a feel for what the preparedness is in terms for children COVID infections, if at all we do see that kind of wave coming in? What do you think the government or even private sector, what is the preparedness, sir? Can you give us a glimpse?
When the Maharashtra had one large group of children getting affected with COVID, so our state government had given a notice to the Indian Academy of Pediatrics, saying that giving a discussion on preparedness of COVID in coming months, especially in pediatric age group. So we have given a SOP. One. Second, we have a track of the beds getting allotted. As soon as the second wave comes down, I think we have sent a request for all government hospitals and private hospitals to allot 15% of the total number of beds for pediatric population. I think when Dr. Nishan would have received, most of the hospitals are planning to allot 15% of the total number of beds in that particular hospital. So we are expecting around 80,000 cases in next 6 months for pediatric case, 80,000. So in that, even if we see the 10% complicated cases, so we are expecting around 10,000 total cases, which might require admission in a good hospital or in a bigger hospital. Right. So we are expecting around 10,000 cases. That's the base we have requested for the government to prepare at least 10,000 cases, 10,000 beds in all of the Karnataka. But fortunately or unfortunately, we had 56 deaths in last 6 months in pediatric cases. This is the government data which I'm telling you. 56 deaths, less than 19 years age. And most of them could stay only for 72 hours. And all of them came with one or the other complications related to COVID. So basically, now there is one group of doctors who will start educating the parents and the public on psychological preparedness and also a triaging. Triaging means they have to contact the nearest doctor whenever there is the smallest of the smallest symptoms in the pediatric age group. So that is when the work starts. So they have to be in a close follow-up with that particular doctor every week to watch for the complications. So once we cross 3 to 4 weeks, even the well child, and we are almost crossing the acute complication phase, where most of them, around 80% will not have a complicated illness, 10% will have a mild complication, 5% will have moderate, and 3 to 5% we are expecting severe complications.
Okay.
So that's how the government has asked us to give a report on this. The report has been sent to the government. I think that the Deputy CM Ashwath Narayan was chairing the session. We have submitted. Government has absolutely agreed to provide the support of logistics, especially the beds and also the medicines. So since the remdesivir is not a medication to be used in pediatric age group, so that is out of question now. So we need only 3-4 medications to treat the children. But basically, there should not be a havoc created by the media, which is very important because pediatrics is an emotional subject, which will be a very devastating for the doctors and the hospital. Any kind of complications or deaths related to the pediatric age group, it is going to be very difficult to control the public, in the hospital. So this is one we have to start working on it, where we have to educate, public education, because managing pediatric complication is not that difficult than managing the public and the parents.
Correct.
So the government will start on media briefing. This is what we are requested the Deputy CM regarding. They have to brief the media, the public around behaving well with the hospital, doctors, behaving well calmly with the doctors and the hospital, so that doctors and hospitals do their work with absolute discipline. Absolutely. So this is one, I think, in this form we are discussing.
Sir, Dr. Abhishek, I have another question with you in terms of pediatric. So, I mean, I know this is a little bit before the pediatric issue, but what about pregnant women? I mean, what's been your experience as a neonatologist, right? You're treating these newborn kids. What about, so like how we see viral infections transfer, like for example, HIV, the parent to child transmission can happen while it's in the womb. Is COVID a virus like that? Does it break the barrier, the blood barrier inside the mother's womb? And also, what has been your experience, treating neonates with COVID? Or have you ever seen a case of COVID in a neonate?
So first I would take up the pregnant women issue. Compared to the first wave, in the second wave, we have been seeing steadily more cases of pregnant women getting infected. So the more challenges what we face is there is more likely that they deliver preterm, and very few of them have landed up with similar severe pneumonia requiring ventilation, and we were forced to terminate pregnancy as well. So a few minority of them have also ended up with something called meconium stained liquor, wherein the newborn has aspirated it and has required ventilation. So what I would say in general for pregnant women is that, so in the second wave, we have had more cases, but fortunately, majority of them had recovered well. Very few of them required ICU care. So the more common what we encounter in a pregnant woman is they come for delivery, and pre-delivery, most of the hospitals would ask them to get a COVID testing done. Right. So there we are getting most of the asymptomatic women who are COVID positive, or they're in contact with somebody who's COVID positive in their house. So these are the cases whom we deliver. So regarding the neonates, the transmission from mother to the baby, if we see, fortunately, Ovum Hospital is one of the part of National Registry. This is one of the 2 hospitals from Karnataka where we contribute our data to the National Registry. I think our data, as per the first wave, less than 10% of newborns were positive when the mothers were positive.
Excellent. Okay.
So what I would like to re-emphasize here is that most of these babies were directly breastfed when mothers were asymptomatic or they had mild symptoms. Despite being with the mother, less than 10% were positive. Positive in the sense they're not symptomatic, again, mind you. Understood. Less than 1% were symptomatic with fever, or rarely they had some cough or cold, less than 1%, what I would say. And the mortality again is 1 in 1,000, I could say, that too when they presented late from 3rd week or 4th week onwards. Regarding newborn presenting, in the first wave, hardly we had cases in single digit from each of the hospitals. But in this wave, I can see in the last 2 months, we already have, in the last month itself, we had around 20 admissions to our hospital, neonates who were positive. So, but fortunately, so these neonates actually had symptoms like vomiting or breath holding. Only some 5 neonates had breathing difficulty requiring oxygen. And fortunately, most of them went home without any mortality. So we do see newborns having COVID positivity, especially when mothers are positive. And another challenge, what I think most of the panelists mentioned, something called multi-system inflammatory syndrome. In children, we are seeing multi-system inflammatory syndrome, newborn, MISN, what I can say. So we had around 2 newborns presenting with cardiac dysfunction. So which on appropriate recognition, we could actually manage well. So listening to all these things, I think most of the people would be worrying, will neonates land up with severe problems? But these are all rare cases, mind you, because we are catering to almost 100-kilometer population. Correct. And we are getting around less than 10% of neonates who are symptomatic, and very few of them having multi-system inflammatory syndrome. And if you are in a regular follow-up with your pediatrician, and if they can refer at an early time, we can manage very well with very complications or bad outcomes.
Fantastic, sir. That was very, very interesting. I'm going to skip out to Dr. Dharma Prasad here. And Dr. Dharma, now we have many, now I'm going to move over to vaccines, right?
Yeah.
There are so many vaccines now. We have the Sputnik, we have the Covishield, we have the Covaxin. We perhaps are expecting Pfizer to come in. We are also getting some home brewed recipes with Cadila and a few others also attempting it here in India. Now, I want you to give a brief to our viewers. What are the difference between the 4 main vaccines, or at least the 3 main vaccines that we are seeing today in India? Sputnik, Covishield, Covaxin, number 1. Okay. What sort of coverage is it giving people? Or is it a myth that one is better than the other? Or is it, all the same? Please, over to you.
Yeah. Now, scientifically speaking, the way these three are made is quite different. So the Covishield, made by AstraZeneca, now synthesized by Serum Institute, is actually a DNA vaccine. That means they have taken an adenovirus and then they've inserted the COVID spike protein within it. So when they inject it, it goes inside the cell, makes the spike protein, and then that is presented and the antibodies are generated. Covaxin, which is made by Bharat Biotech, is a attenuated vaccine. That means they have grown these viruses inside the tissue culture cells and then they have killed it. That means they have attenuated using chemical treatment, but they have retained the structural component of the virus. That means they are no longer infectious, but they can still go inside the body when they inject it and they can elicit a response.
Similar to polio vaccine, right?
Yeah, very similar to polio vaccine. There are a lot of vaccines of both kinds which the child gets in our growth cycle.
Right.
And the Sputnik is also somewhat similar to Covishield, where they have taken adenovirus and they have put a spike protein. So that is also a DNA virus. But the Pfizer and the Moderna vaccines, which is not there in India, is a mRNA vaccine, where they have taken an mRNA and put it inside a vesicle of a fat vesicle and they inject it. So basically what it does is it skips the DNA stage. Directly the mRNA is translated into protein, which generates antibody response. These are different vaccine technologies that we have generated. Now, the Covishield in a multi-country clinical trial says it is about 70-75% efficiency, right? After 2 doses. 2 doses, it improves even better. First dose is about 50-60%. The second dose, 90% coverage is what they say. Overall in population, about 75%. Covaxin also claims around 75-80% range of coverage. That means about, if you take 100 people, 80 people will not get the infection or symptoms. The other 20-25 people will show some symptoms. But after taking both 2 doses of these 2 vaccines, there has been no cases of severe COVID infections. That means the coverage is absolutely almost 95 and above percentage, where after 2 doses of vaccination, severity of the COVID infections is dramatically reduced, right? Now, the way vaccine trials are done, they're not done parallelly in the same population during the same time of COVID infections. Because of this, you see a variation of somebody saying 70% efficiency and somebody saying 80%, somebody saying 90%, because they're not done parallelly in the same population setup. Because somebody does it early during the early stage of peaking of the diseases, you see protection is much greater. Whereas when you did during the peak, when the disease is ravaging, your coverage percentage comes down because there are some people who will still get infections. So that is the only difference. So ideally, don't go by the percentage numbers. Don't worry about the kind of vaccines. All are good, equally protective based on what the science says.
Fantastic, sir. I think that's very, very... Nishant, coming over to you. What's been your experience of treating people who have been vaccinated? At least say, for example, 1 dose of vaccine, get infected with COVID. What has been your experience in seeing clinical outcomes in such cases?
As Dr. Dharma told us, that people, I think vaccination is very important. And what happens is, I think it reduces the severity of infection. We've had patients who come with first dose, second dose, and then they've been infected. They ask us, even in spite of 2 doses of vaccine, why are we infected? Vaccine will never give you 100% immunity. It only gives you a cover to better your immune system and probably reduces the severity of infection. We've had patients who come with, and we've had a few deaths also because the immunity or the immune response hasn't been that great in those patients. And the cytokine storm has already developed. And even in spite of vaccinating with 2 doses, they've had problems. So it has nothing to do with the vaccination, but probably the immunity of the individual that has probably caused the death of the patient. So that is one of the other thing. What I would say is, I think we've had...
It does help, right? It does as at a public health level, there is some benefit to vaccinating people, right?
Definitely.
I want you to bust the myth of vaccine hesitancy here. A lot of people say, I took the first dose, I still got it. What's the point of taking the second dose? Can you throw some light on such a situation?
Yeah, absolutely. You can see us. I think all of us as doctors here have been vaccinated, and we are sitting here and we've been with the COVID patients day in and day out. You can ask Dr. Shivu. I think we are the most infective, you can say, probably because of the immune response. And with the vaccination, I think probably we would have had the cough, cold, fever, or something like that, which is very, very minor side effects of the vaccination. But still, having said that, people will definitely see a response to whatever the foreign body enters the body, right? So that is why they develop some kind of side effects of fever, cough, and cold. Some may experience fever for a little longer time, but definitely it is trying to tell the body that we've developed your immunity and probably we're fighting the foreign body that is coming in. So whenever they are infected really with the virus, they probably will have reduced or probably the severity would have come down. So I think the myth is you should not think about if there is an allergy, if there is an hypersensitivity to the first dose, then I think avoiding the second dose is all the most important. But definitely, I think vaccine will definitely help everybody. And that is how we probably break the chain. And the virus it'll cause cessation of the multiplication of the virus.
Perfect. Dr. Shivling Swami, can you throw some light on, for example, somebody has taken the first dose, got themselves infected in between, and then when do they become eligible for dose 2? And depending on the vaccine type.
Definitely, by and large, as sir was mentioning, a vaccine has helped a lot. It will definitely prevent hospitalization. It will prevent mortality. It will prevent death. Okay, vaccination will. There are few cases where people are not able to produce sufficient antibodies against the virus. Even after taking vaccination, there are few cases which we have also come across. I've seen doctors also having same issues. But first dose and second dose with a gap of at least 6 to 8 weeks has been very effective. I have seen back in March and April, wherein the elderly population, the father has taken the vaccination in March, and now both the father and son have been infected. Son is having moderate disease, and father is having very mild disease. Even though they both are infected, they have got infection at the same time. The father is having a very mild infection, not having any shadows in the lungs, whereas the son is having moderate disease. So vaccine is very, very much effective. And second dose, if a gap of at least 6 weeks to 8 weeks helps in boosting the immunity pretty well. Soon after infection, someone is getting infected even after vaccination or before vaccination, they have to wait for at least 2 to 2.5 months because they would have had sufficient considerable amount of antibodies in their blood that will help them prevent reinfection or lapse. And after 2.5 months of infection or vaccination, if they take the second dose or if they take a vaccination first dose, it will definitely boost up the whole immune system to generate more and more antibodies in their body and give them protection, good protection.
Perfect, sir. So, Dr. Abhishek, there are a lot of queries on child vaccination. What is your view? When will India see some vaccination for children starting? It has already started in the US and a few other developed countries. Can you throw some light on that, sir?
See, generally, when we do vaccine trials or research for that matter, our concern will be safety apart from efficacy. I think we have already proven efficacy in adults that these vaccines are effective.
Right.
Regarding safety part, I think we have seen very rare complication, that is somewhere 1 in 10 lakh of them are having some thrombosis or some brain related problems, which is again very rare. We are not sure how children.
Is this in children? This data is for children?
This is in adults actually. So considering this actually, these safety concerns, so the trials have not happened in children. That's why the government is not recommending in children at the moment. So they would want to have a trial, look at safety data and then recommend. So at present, as you mentioned, in US as well as many European countries, about 12 years, I think they've already given recommendation. Yes. I think Government of India will also come with a similar recommendation very soon for about 12 years. And remember, children are not small sized adults. They behave differently. And children of 2 to 12 years, 2 to 18 years for that matter, already vaccine trials have started. And it is going to take easily next 12 to 16 weeks to complete the enrollment as well as to have the data. And once the data is published, then probably the recommendation will come in. So I would say it will be not less than 6 months that we are going to have vaccination for children above 2 to 12 years. For about 12 years, I think probably we'll soon have a recommendation for earlier vaccination for them.
Perfect, sir. Sir, I want to skip out to Dr. Rajshekar Jaka here. Sir, amongst all this, right, we have seen the first wave, we have seen second waves, we have seen lockdowns, we have people who have been infected, friends and family dying, all of this. What, how do people have to maintain their mental sanity at this point? They are getting now affected mentally. Now, COVID is one problem. The collateral mental illness is now a big challenge. What are you seeing in your clinical practice?
It's a very tough situation because we have closely seen the families who went through this, and the majority of the families, either one or the other member in the family or friends or relatives, now had this problem of COVID in this second wave. Tumba traumatic ide. Definitely I agree. Not only mental, financial ತುಂಬಾನು ಆಗಿದೆ, ಆಮೇಲೆ ಮಿಕ್ಕಿದ್ದು ಬೇರೆ ಬೇರೆನೂ ಇದೆ. So we have to be positive, that is no doubt. ಯಾರು ತುಂಬಾ ಪಾಸಿಟಿವ್ ಆಗಿರ್ತಾರೋ, in not only in this case, anything in life will be better managed when they are positive energy. So there is no doubt about it. ಆಮೇಲೆ ಈಗ ಚಿಲ್ಡ್ರನ್ ಬಗ್ಗೆ ಇಷ್ಟೊಂದು ವರಿ ಮಾಡ್ತಾ ಇರುವಾಗ, ಐ ವುಡ್ ಸೇ ದ ಬೆಸ್ಟ್ ವೇ ಟು ಪ್ರಿವೆಂಟ್ ಚಿಲ್ಡ್ರನ್ ಗೆಟಿಂಗ್ ಇನ್ಫೆಕ್ಟೆಡ್ ಈಸ್ all the adults in the family should get vaccinated.
Right.
That is the way we can protect the children. Rather than concentrating too much on vaccinating children, I feel all adults in the family should get vaccinated. Then majority of the problem is solved. And anyhow, we are there because children are not going out now. Probably another 1 year it may happen that schools may not open. So problem will definitely be under control. So this is one thing. And I as you said, see, I have seen my school junior calling me and telling both my parents are in the ICU, and they are there since last probably 2 weeks, and I have already spent 15 lakhs. I cannot spend anymore because I don't have anything now. Please, can you save my parents? It is such a traumatic, that day was so traumatic for me because I am helpless. Though I am a doctor, but I can't do any magic now. And I have to shift both of them to the government hospital because they're not affordable. But at that moment, beds are not available. So it is really traumatic for me also, that I am so helpless because I'm a doctor, but I can't do anything. So these are the situations where sometimes I don't think this situation will come again and again. This is a once in lifetime. We have to be more positive, more compassionate to everyone, give mental support. Though we are unable to help in a financial or any other way, but at least psychologically we should be able to support them, each and every person in the relatives, family, friends. I think we should give positive energy to everyone, so whether they are infected or not, rather than having a stigma. Avanu infect agidane anta, initially there was a lot of stigma. Oh, infect agidane andre avanu onthara avangeno onthara different agi behave ಮಾಡೋದು ಅವನ ಜೊತೆ. Not required. I think these are the things which we can do.
Nishant, we were speaking, offline during the discussions on this program. One of the things that is very, very understated, and you also mentioned that, was mental health for doctors, because even these are clinical situations that you have not seen routinely. It's really, really difficult times, even for medical practitioners, because you were mentioning in one of our conversations that you have declared the highest number of deaths in a single week. That is unbelievable. How are you people maintaining mental sanity? I think that's a lot of interest to our viewers.
I don't know, but what I would put across is, I think the grief, the fear, the loss of life, everything has come together. I think even for us to cope up with it is going to be so very difficult. But when you see a lot of patients, forget about the death part is always there. We've also seen patients who have walked out of the hospital. We've had pregnant ladies who've been delivered in an emergency surgery, had a cardiac arrest, and we've intubated the mother, and she's walked out. And we've had youngsters who've been intubated, who've collapsed in the department, and we've intubated them. We've kept them on a ventilator for almost 15-20 days, and they've walked out. They send a thank you note. I think that is what keeps us going. We've also seen, I think, as Dr. Rajshekar told you, that we've also had so many families wipe out. You can see, I've had instances where I've been counseling a person in the ICU, and there is a death of a patient. the person asked me whether that patient is my brother, because that was actually his brother. He could see his brother. Okay. And that guy died. I couldn't tell him that it was his brother because I don't know what is going to be the impact on this guy. So I wanted him to be alive. He was on an non-invasive ventilator. And when that guy died, the next day, this person had a problem and he also expired. And he had another brother who was sitting in the other cubicle who saw two bodies go out, and he felt that both of his brothers have been have died. So even that person over a period of time lost his life. So we've had complete families wipe out, and the bread earners I'm talking about. I think it's a social impact, the economic impact, because initially in the first wave, what happened was there were only 3 lives, means probably only trying to understand the stigma of the infection. People thought it's an infection and we need to deal with it because there was no lockdown and things like that. The moment lockdown happened, people started having loss of economic life. There was no money for them. And when they started losing their families and friends, or probably elderly person who was a bread earner, that is when it impacted so much for them. And trying to declare these patients to the kith and kin who haven't seen their family person for a long time. See, you can understand that in any other normal circumstances, people will go to the ICU, they understand the situation, they see a patient who's probably on the deathbed and who will not make it. But here, a patient comes in walking and goes out dead, haven't been seen by the family for a long time. So now, after the first wave, we were not able to do that. Then in the second wave, we started showing them, asking them to do the video calls, talk to the patient. So that kind of bonding still remains so that they can actually fight the infection and come out. I think only because of the willpower. I'll tell you this much. I think most patients, when they lose their willpower, that is when no treatment of ours is going to save them. So that is that stigma, and we've been seeing a lot of deaths because of that. Yeah, I think these people who go alive and go walk out of the hospital, send a thank you note and say that thank you for everything what has happened. I think we feel blessed. I think we are there. I think as Dr. Shu told, we've been, I think, working 23 hours a day, probably having those 2 hours of sleep, and not a good sleep. It's a disturbed sleep. You know that you would get calls, and every time we don't want to switch off our phones because we know this is the time we are needed in the hospital, or for anybody for that matter. We would want to pick their call and say, oh, we're there, come to the hospital, we'll treat you. So limitation is such that we won't be able to do much, but definitely whatever we could do within our limits, we've done that. I think all of us are proud to be in this fraternity and trying to save a lot of lives. I know a lot of deaths have also happened, but I think the percentage of deaths, we've kind of prevented it. Having said that, because if we had not treated them or probably not picked the call or something like that, we would have lost a lot of lives. So I feel that that is one thing.
I'm coming to the end of this program with a couple of last 2 questions. Dr. Shivling Swami, can you throw some light? There's a lot of misinformation on social media. We will not go into the details of what misinformation is being circulated, but I want you to make an appeal to our viewers to stop it. And what else should you be doing in place of that?
No, of course. Very much right. So social media is playing both roles. In fact, it is playing a good role, and also at the same time, it's playing a very bad role where people are getting wrong information, especially steam innovation. Their people are steaming to the glory from morning to evening, and they end up having reduced mucosal immunity. That they're developing other complications, and they're following all. Though I would not comment here that other mixopathies are not doing well, not really helping them well, but people definitely have to get aware. They have to have the proper education of how to manage COVID cases. And the first thing, if they, in this pandemic era, wherein if someone develops fever, if someone develops mild cough or having any symptoms which are looking like COVID, they need to seek medical help, whether it is a small PHC or a GP, or because now everyone knows how it can be treated. So rather than getting afraid, getting panicky, being at home and just getting afraid, the whole family getting devastated. So it's all about going, seeking the medical help, taking proper care, taking proper medication, and then keeping a very strong positive mind that I'm going to recover, I'm going to do well. So this is the most important thing. As sir was mentioning, it is very devastating for us to see patients losing hope because they won't be able to see their kith and kin, especially when they're in the ICU, when they're put on NIV, they are not even able to speak. They have not seen their kith and kin for 4 days, 5 days, 10, 12 days, and they feel that death is imminent, it's there coming to them, and they feel that they are lost, they are going to die. So this is what is happening. So what I really want to say is to keep strong positive mind that you're going to recover, you're going to do well. Hydrate yourself very well, very important. Whenever there is fever, take paracetamol, have a strong positive attitude, take medical help early. It's not about medical help, matlab, it doesn't mean that you have to go get hospitalized. 80% of people doesn't require hospitalization. Home isolation, home treatment is more than sufficient. It is all about hydration, paracetamol, and a strong mental attitude. That's all is required. That's all is required. 20% of people who are having moderate to severe disease are going to get hospitalized, they're going to get treated, and they're going to become better. It's by and large, what you have seen, the case fatality rate is not more than 2%. If you take the whole population, people are getting infected, case fatality rate is not more than 2%. It doesn't mean that we should be relaxed that no, nothing's going to happen, I'm going to stay at home, I'll be all right. Whenever things are not happening, if you're taking paracetamol for 4 days, 5 days, fever is not reducing, fever is again coming back, or you're starting having new symptoms, having more fever, immediately come to the hospital, take medical help, get yourself admitted, take treatment properly. Don't wait till symptoms become more severe. When you start doing breathlessness, saturation dropping down to 80%, then you come running to the hospital seeking medical help. That is not the right thing to do. 5th to 7th day is the key. From the day of onset of symptoms, 5th day to 7th day, if you are having persistent fever, if you're developing new symptoms like cough or breathlessness, or if fever has gone again, come back, this is the time you really have to go to the hospital, get yourself admitted, get evaluated and treated. More 80% of people in the first few days, they're gonna have minimal symptoms, fever, cough, and eventually everything will settle down. 80% of people doesn't require hospitalization, hydration, paracetamol, and that's it, nothing else.
Great, sir. I will now skip over last question, Dr. Dharma Prasad. I want you to sort of comment. We have spoken about the WHO. We have spoken about, what we have seen, what has happened in the BBMP. We have seen what has happened in ICMR. Look, the public at large are losing confidence in organizations that they were rather trusting. Now, how are these organizations going to build back their credibility? And it's also a question of who to listen, who not to listen, what is the truth and what is not the truth. What is your feeling on this mood, right? Because that's the prevailing mood amongst people today.
Yeah, no, it is. See, whenever anything new comes, it is challenging. Nobody knows what to do. Nobody knows how to approach it. So there is a lot of confusion. See, WHO deals at a very different level, BBMP different level, state government different level. And the biggest problem we have faced in India is we don't have the right expertise of public health and epidemiologists. We have epidemiologists, but the problem is, unfortunately, most of these governments listen to people whom they know who are expertise in a different field, not exactly handling virus infections in a public setup. We don't even have a public health specialization in medical degrees, right? Unlike many of the developed countries. So we have had confusions because of listening to too many people and not coming to a proper structured approach. That's mainly because we were doing more of a fighting in an emergency rather than a systematic thought process. See, most of our other diseases came over a period of time. So we developed protocols, we developed triage conditions, we developed systematic approach to treatments and taking care of the situation. Whereas now suddenly something came, nobody understood what is happening, nobody understood how things are shaping, nobody understood the first wave, second wave, the mutations, the vaccines. RT-PCR is only 70% capable of detecting positive rates. Everything has a certain percentage, and they're not systematically developed over 5 years of time or something like that. So the confusion happened because of the sudden emergency and sudden knee-jerk reactions, and that needs to stop. And systematic approach and organized listening to experts have to happen, Because see, most of the things gets political at the end of the day. It doesn't happen when there are 3 or 4 human beings. The politics is natural. So WHO has its own politics. Governments have their own politics. BVM has its own way of dealing with all these things. So that created confusion. So the get back credibility, you know, the first question you asked, they have to take care of listening to the experts. I think many of the doctors here are actually as a part of panels who give advices. These advices have to be listened to by the people in power, the bureaucrats and the politicians. And accordingly, a systematic approach has to be taken care and taken the situation. I think they've handled relatively better now compared to when the second wave started. Now things have started settling down. That the people know what exactly needs to be done. There is a protocol for treatment, right? You won't believe it. People never bothered about a treatment for COVID until now. Everybody went behind vaccines because vaccines is where, you know, see, there is economy also involved, economics involved in this, right? Vaccines make more money than treatment because treatment you give only to diseased people and vaccines you give to everybody, right? Now that they're expecting this is going to be more seasonal and it's going to stay for a much longer time, people have started thinking about drugs, right? My company, I have developed 4 different molecules for COVID. Now, nobody even looked at my molecules for the past 1 year. They didn't bother. Now there is interest. Now people are taking seriously and saying, okay, now we need to have some drug, you know, that will also make some ROI. So people's attitudes have changed now. I think things are getting little more organized and it will get better.
Correct. Absolutely. I think, you know, it's been an hour and a half. I don't know how we did go through this an hour and a half, but I want to, Avinash sir, can we take any audience questions at this point? Because a lot of our panelists have answered right there in the chat box itself.
Yes. Most of it has gone in the chat box. I'm watching that. I think any more queries can be posted, or probably 1 or 2, something different from apart from what is there in the chat box. If somebody's got, you can kindly.
Okay, so I will take a couple of them here. You know, Dr. Just look at it. Yeah, so I think a lot of questions that have been on public messaging and media, the role of media. Nishant, you know, we spoke about this at length, right? Because you're talking about all the positive stories of people who walked out of the hospital. But what gets reported is only, you know, they show all the crematoriums, not only local media, even we have seen this even in the international media. If there's anything you want to send out a message, what is that you would do for, you know, media people? I don't know if there are some journalists in this group.
I think you would know them. You need it to be more spicy.
Yeah.
And if you tell them that people have walked out, people will stop believing that COVID can cause havoc in life.
Right.
So they wouldn't want to put up news or probably say, I think as we've told that there are a lot of things that have been found to treat COVID, but none of them are on papers.
Absolutely.
So you can see that it's only that death and the grief, everything is put up so that people have that fear in them. So more than actually trying to show that, yeah, what things have been done and how things have been taken care of, like it has been organized by the system, that hasn't been shown. So very difficult to talk about media doing something good for us. I think if now at least they need to realize and do better things for us, for the public rather.
Dr. Prashant actually mentioned the media briefing kit and things like that, because I think he's on the task force for pediatric. So what would you kind of bring to that media kit, you know, as a man inside the system?
Actually, most of the havoc which is media havoc creates, probably it's one of the trigger point where the pharmaceuticals gets benefited. If you look at things, for example, I'll give an example of remdesivir. The last 1 year, there are 30% of the people were roaming around to get remdesivir, and now somebody, WHO makes a statement that remdesivir is not useful. Look at the amount of remdesivir which has gone into the patient's body, and look at the pharmaceutical industry which is running the show. So there is economy. So there was a saying that China started the COVID, and the COVID vaccine became an economic subject in India. So basically, it's economics which works because of the population. It's a huge population.
Correct.
So we want this to go into the people's mind, saying that please do not get panic when there's an illness. So that has to be brief. For example, we do not know how many people have got admitted. We do not know how many people have expired. We do not know how many people are on ventilator. So we have requested the government and health secretary to brief the media and also the public every day at 7 p.m. so that the whole state knows what is going on with the pediatric population. So basically, this is one which we have to brief it, because panic in pediatric is devastating. Pediatric population affecting, no beds. We can't even imagine how bad it's going to be on a parent's mind. So it's going to be very bad for the doctors who manage. It's going to be very bad for the hospitals who take the cases. So we are requesting them to brief through the media to the public every day at 7 in the evenings about the status of the bed, the number of admissions and number of discharges and the deaths. So that's very important to keep the public informed when there is a pandemic like this. So that's a request we have put it to Deputy CM. I think they will do it probably because this second wave has damaged the government so badly. I think they have to do this to retain their strength for the public reviews.
Like I mentioned, sir, I mean, how are they going to build confidence back? Yeah, Nishant, sorry, you were saying something.
Yeah. No, I think these things have already been taken up during the adult issues, but the problem is it doesn't get percolated to the rest of the other members. Members in the sense to the public or to the hospitals. So you wouldn't actually give proper figures because there are so many other issues. I don't think so that has been controversial. We don't have to speak about it. But whatever said and done, it's been there. But I think it has to be followed. I think better late than never. I think we've already seen in the second wave. I think for the pediatrics, I think they should follow it judiciously, is what I meant.
We really have to show only positive information over media. So show only positivity, that's all. There's no point showing crematoriums, no point showing dead bodies lying down there. Just show positivity, how hospitals are working, how many people have input and walked out of the hospital. Few deaths are there, definitely it's a pandemic, but show how people are working hard, how all of us doctors and medical healthcare facility are working so hard to get people health right and getting them walk out of the hospital with all their good health. So show only positivity on the media. Better stop using negative information on the media. It's only creating panic in the whole society.
Absolutely. In fact, I saw a tweet by a very prominent doctor. He said, just because overfilled crematoriums, he can also take pictures of crematoriums where they're empty. Doesn't mean anything. It's vanity metrics, right? So at the end of the day. So, I mean, from my end, as a panel moderator, I want to thank all of our panelists today for such a fantastic and engaging session. Dr. Nishant Thiramat, Dr. Nishant Madhapur, Dr. Abhishek Aradhya, Dr. Shilling Swami Salimat, Dr. Rajshekar Jaka, and Dr. Dharma Prasad. Thank you so much for such a wonderful session. And also thank you all for answering queries on the chat box. I think that is very, very nice of you all. Thank you very much. I'm giving this over to Avinash Palagar now, sir.
Yes. Thank you, Dr. Chinmay. I would request Srimati Sujata Rajanna to share a few words. Madam, on behalf of Sneha Trust, I request you to kindly say a few words.
Vikram, can you mute others?
Thank you very much. On behalf of Sneha Trust, I thank you very much for this beautiful program, and we needed this because each one of us are so scared of what is going to happen and how long can you stay home and without doing anything. And this has become, in a way, mentally also people are getting disturbed because they have to stay home all the time and they don't know what to do, only cook and take care of the house and other things and sit at home. And that has become too much. But now, after listening to all these doctors, I feel we are more confident. We have taken 2 doses of vaccination, and many of them can do their regular activities maybe in few more days, I suppose. All these things are such a welcome thing, and we are happy that you have done a beautiful job. Thanks so much for including us, for involving us in this program. Thank you.
Thank you. Thank you very much for the kind words, madam. I think we will come to the end of the session. So, Nano, on behalf of ILYF Charitable Trust and ILYF Bangalore chapter, ILYF Mysore chapter, and Hubli Dharwad and Tumkur, I extend a very warm, heartfelt thanks first to our esteemed panelists. We have Dr. Nishant Thiremat, Dr. Rashekar Jaka, Dr. Dharma Prasad, Dr. Abhishek Aradhya, Dr. Shivling Swami, Dr. Prashant Madapura, and our Dr. Chinmay Chikteri. My heartfelt thanks to each one of you for having made time in spite of all your busy schedule amongst the COVID times. Thank you so much for giving us your valuable time and sharing valuable inputs. We are deeply grateful to all of you. Thank you. I would also like to take this opportunity to thank Shri Arvind Jatiji, the President of Basu Samiti. Again, Dr. Chinmay Chikteri, the Chairman of the Digital Committee Basu Samiti, and all the other esteemed office bearers of Basu Samiti for having partnered with us for this program. And I would also like to thank Srimati Umadevi Chandrasekhar, the President of Sneha Trust, Srimati Sujata Rajanna, the Secretary of Sneha Trust, the esteemed trustees of Sneha Trust, and a special thank you to Srimati Manjula Shivprasad for having connected us to Sneha Trust. We are really grateful. I am also thankful to the President of ILYF Bangalore, Shri Prithvi Prabhakar, the ILYF Mysore Chapter President, Shri Prashant Ji, to all our esteemed trustees of ILYF, Shiv Prasad Talur, our Chairman, Vikram Karachur, and our Executive Committee members of ILYF Bangalore. A special thanks goes out to Netra Channappa, Pratap Aradhya, and last but not the least, I am thankful to our admin Vikram for having helped us with all these programs. So I know it has been a lot of online programs, but in spite of that, we've had a very good attendance. We've seen more than 100 plus members log in on Zoom, and quite a few members on Facebook also. These programs will also be posted on our Facebook pages and YouTube pages. Basu Samiti is also going to stream these programs on their channels also. I think ತಾವೆಲ್ಲರೂ ಸಮಯ ಮಾಡಿಕೊಂಡು ಈ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿದ್ದೀರಾ. ಪ್ರತಿಯೊಬ್ಬರಿಗೂ ಐಲೈಫಿನ ಎಲ್ಲಾ ಸದಸ್ಯರಿಗೆ, ಸ್ನೇಹ ಸಮಾಜದ ಎಲ್ಲಾ ಸದಸ್ಯರಿಗೆ ಹಾಗೂ ಬೇರೆ ಎಲ್ಲರಿಗೂ ಇವತ್ತಿನ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಭಾಗವಹಿಸಿದಂತವರಿಗೆ ಎಲ್ಲರಿಗೂ ನನ್ನ ತುಂಬು ಹೃದಯದ ಧನ್ಯವಾದಗಳು. ಸಮುದ್ರದ ತೀರದಲ್ಲಿ ನಿಂತು ಅಲೆಗಳು ಬಂದು ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಹಾಗೆ ಈ ಕೋವಿಡ್ ಅಲೆಗಳು ಬಂದು ಹೋಗ್ತಾನೆ ಇರುತ್ತೆ. ನಾವು ಮನಸ್ಸನ್ನ ಗಟ್ಟಿ ಮಾಡಿಕೊಂಡು ಈ ಆಗ್ಲೇ ಮೊದಲನೇದು 2ನೇ ಅಲೆನ ದಾಟಿದೀವಿ. ನಾವು ಇನ್ನೂ ಮೈಂಡ್ ನ ಪಾಸಿಟಿವ್ ಆಗಿ ಇಟ್ಕೊಂಡು 3ನೇ ಅಲೆನೂ ಬರ್ಬೋದು, 4ನೇ ಅಲೆನೂ ಬರ್ಬೋದು. ದಯವಿಟ್ಟು ಈಗ ಹೇಳ್ತೀನಿ ಅಂತ ಕ್ಷಮಿಸ್ಬೇಡಿ. ಗೋಡೆ ಮೇಲೆ ಫೋಟೋ ಹಾಕ್ದಿಲ್ದಿರೋ ಹಾಗೆ ದಯವಿಟ್ಟು ಎಲ್ಲರೂ ಮನೆಯಲ್ಲೇ ಇದ್ದು ಸೇಫ್ ಆಗಿರಿ. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್. ಥ್ಯಾಂಕ್ ಯು ಒನ್ ಅಂಡ್ ಆಲ್.
Thank you. Thank you for all the doctors. Thank you so much.
Thank you.
Thank you. Our environment and our population. Especially, I think the second wave, I think we have seen